autonomic nervous system that's very sympathetic, it's very reactive.
If you're wired that way, you can be unwired as well, can't you, with neuroplasticity? And that definitely is the one thing, isn't it, that you, when you're doing breath training with someone, they develop that self-awareness, don't they?
Good morning, Internet. My name is Ber. I'm a nurse and I work for Meliora Wellbeing. Today, we are talking with Dr. Louise Oliver about what we didn't learn when we were in our medical training. What name do you prefer? Louise?
Louise is absolutely fine.
Perfect. So the open-ended question, stuff we didn't learn in our medical training and things that it's really interesting how the perspective is once you learn something and really go down that rabbit hole and really understand the depths of it, it really changes our practice. And it really makes us realize that the training that we got was lacking in a way, because if this one little important piece of information was shared with us, it would totally change how we would have began our practice.
Absolutely.
Yes.
And I think the biggest thing for me is probably how we breathe matters, and there's lots of bits to that, but just I was taught about how we breathe and various bits of that that are important, but actually the bit that we have, how we breathe matters, and that can be efficient breathing or that can be inefficient breathing. And actually that recognition, unfortunately, I've been a GP more than 20 years now, and I've only come to that recognition in the last sort of few years, and actually it makes a huge difference to how people feel, because breathing is it's our foundation, you know, it's where everything else is built from. So if you have inefficient breathing, then potentially your foundation of life is unstable or not secure, and then it can be amazing how it affects lots of different systems.
Yeah, and so I never introduced that. Our topic that we're specifically talking about today is breathing, because you and I both in our practices, you as a physician, myself as a nurse, how we have came to the breathing practice and really understand breathing. And when we talk about breathing, it can sound very cliche of like, oh yeah, breath again, everybody's talking about breathing, but it's not cliche. What we're talking about isn't cliche. It's a lot deeper than that. It's really all encompassing on how it affects everything of our physiology, our health, our well-being, and our health trajectory. So that's really what we're talking about, isn't it? And how you can change a lot of things about your life and how you feel through your breath.
Completely. If you think about it, every single cell, tissue, organ system, every single one of those has to have breathing as part of it. You know, it needs oxygen and it needs to get rid of carbon dioxide. So it absolutely affects everything, and there's very much an interlinked with our nervous system. So our, that sort of mind, body, breath connection, which I again only appreciated in recent times, and we can actually influence how our body responds to different things. And certainly I have to say I was taught so many things at medical school, but just the practical application of how important it is and how you can actually change things, I haven't learned until recently. So I think it's really important that people know about that.
Totally. So if you were to go back, or if you were in control of training new health professionals, what would you put in everybody's curriculum?
Well, I think it's there. It's sort of, so when I'm getting taught about the functions of the nose and the functions of the mouth, it's actually saying use your nose to breathe and use your mouth to, chew, yawn, swallow, and all those other things. And actually making that distinction that using your nose to breathe 24 hours a day is actually really, really important. I was taught about something called dead space, where the first from mouth to sort of bit further down in your chest. When you breathe in, you can't exchange air at all. And actually, the faster you breathe, the more that becomes important, or more it makes breathing inefficient. So actually, I was taught that if you breathe slower, you actually get more air exchange lower down in your lungs, which is important for getting decent oxygen delivery to your body. But then I wasn't taught, well, encourage people to breathe slower. So it's just that extra bit. And I think, and then the other bit that we're both very passionate about is the autonomic nervous system. So again, we probably need to expand about that, but that's the part of the nervous system that controls all the unconscious processes. So every single thing that happens in our body that we don't have to think about. So, you know, that sort of temperature control, blood pressure control, pulse, etc., breathing, all those things, they happen under automatic control. But how we breathe influences whether that's in that fight flight mode or whether it's more in that relaxation response. So again, it was just making that practical link that I was taught about the autonomic nervous system, but the practical link of applying it to day-to-day life to try and have health and well-being and thrive.
Yeah. So I just want to slow down and really emphasize, and let's talk about this slowing breathing. So a story to really open up how to really think about that. Our bodies intuitively already know this, but how we practice in a day-to-day and how our society and how we mirror our parents and other people and how to breathe, we don't do it. But intuitively, our body already knows it. So for example, picture somebody who's really crying, like maybe a child, they're bawling, they're like, it's like really fast, like in and out, their breath is very fast in, very fast out in their very full body cry. In that transition, when people transition out of that really deep cry and they start to transition into a recovery, what happens? You notice that people will breathe in, they'll breathe out, they'll hold their breath, and then they'll breathe in slowly. So as they transition out of that emotional dysregulation into more of a regulated state, and naturally our breath transitions to a slower breath and a pause on the exhale. And it's really fascinating how we do that automatically, but don't consciously know that.
Yeah. And I think, I don't know about what your experience is, but certainly my personal thoughts are since COVID, obviously a lot of us had to wear masks, and I do think it's really quite natural when a mask goes on, you naturally want to mouth breathe. And I find that I still do that, but because mouth breathing feels so strange to me now, I instantly notice it and it reminds me to close my mouth. And I think a lot of people have perhaps just not had an awareness of it, switched to mouth breathing, and as soon as your mouth is bigger than the two nostrils, so instantly that means that you're breathing a bigger volume, and you're probably going to be breathing faster because you can expel the air much quicker through a mouth. So I think, I don't know what would be interesting what your thoughts are, but I definitely think there's been a significant change since COVID. But what do you think?
Two thoughts on that one. So masking, yes, I believe a lot more people breathe through their mouth when they do have a mask. For me personally, I feel like I put on a mask and I just feel like I relax more because of the extra carbon dioxide. I don't like the flow of my breath coming out of the surgical mask and going into my eyes. So I get a lot calmer when I put a surgical mask on because I purposely breathe slower so I don't have to have that airflow going out. And yeah, anyways, but that's me personally. But yes, I have noticed other people, and my kids, all three of my kids, since wearing masks, they breathe through their mouth more than they did previously. So they have more dysfunctional breathing patterns as a result of mask wearing for that exact same thing that you're talking about. So yes, I am that hounding parent to breathe through your nose, but I can't make that change for them. They need to be in charge of making that change themselves and have that awareness. And that's up to them and when that timeline happens. But going on the breath and how I want to go talk more about how it relates to clients. So in nursing, we are helping ambulate, like getting people to move out of bed after surgery or sickness, or really help with their anxieties through a lot of procedures. We have a lot of hands-on time, and it is amazing how, let's take somebody who's just after surgery, needing to get out of the bed the first few times. They're really nervous, they have some pain, they really don't want to get up, they're not sure if this is going to hurt more. And automatically with that anxiety, that worry, that thought, they're already starting to breathe through their nose or mouth and hyperventilate a bit and breathe a lot faster and louder. So I will stop everybody. I will stop the other nurses. I'll stop the patients. And I'm like, no, let's stop. We need to go slow. And I will, like, often patients will have multiple blankets on them. So I'll purposely slow it down by taking one blanket off at a time. And then I'll fold it up nice, and everybody's standing there watching, but I've forced the staff to slow down. I forced the patient to slow down. And while I'm doing that, I'll cue, I'm like, okay, slower breath. Okay, now through your nose. Okay, now we're going to sit up and break it down into smaller steps and make it go slow. And it's amazing how they're going, ooh, ah, yeah, to all of a sudden slowly getting up and going to the washroom or walking or whatever the goal is. It's amazing that shift that you can have just with slowing the pace and slowing the breath. Yeah, so it really, really impacts how everything is done. I don't know if you've seen anything like that in your practice.
No, definitely. I mean, one of the things, it's changed. So I qualified as a doctor in 1998, qualified as a GP in 2002. And it's, in that time frame, everything's changed, the internet and everything. And I obviously now work with a lot of allied health professionals. So and also a lot of patients now realise that certain things like viruses, that you don't need to come to the doctor. There's a lot more self-care going on. So the sort of patients that I see now, certainly, I don't know, in the last 10 years or so, are way more complicated than perhaps what it was. I think obviously people's life expectancy has increased. There's a lot more medications. So there's lots of things that come into that. But I definitely feel that I have patients who are definitely more complicated. And in more recent years, I feel like I've run out of traditional options. So I do all the sort of, all the normal traditional medical thing. And then I'm sort of almost a sort of, well, I'm not got anything else to give you. And I really hate saying that to someone. But from a traditional medicine point of view, I feel like I've run out of options. But then I've still got someone who's distressed in whatever way that be, a physical or a mental sort of health issue. And I genuinely, when I was 16, I decided to be a doctor because I wanted to help people. And that was still the reason when I applied, when I was at my medical school interview. Some people say it's cheesy, don't say it, but that was the honest answer. And I still feel like that. I still want to help people. But I sort of probably actually did feel quite disillusioned, or very disillusioned, that what I was doing, I didn't actually feel like it was making a difference. And and sometimes in some conditions, as with like blood pressure, or you're treating high cholesterol, you take someone who's actually got no symptoms, you end up treating them with tablets that give them side effects, and you actually make them a bit worse. Or that's the perception, but the ultimate aim is obviously to hopefully make them have a longer health span. And then, so certainly I felt really quite disillusioned. And then it was a very bizarre moment. I chose mindfulness in an appraisal, and I just started to find out more about how our body can change and how we can influence that. And then, as you say, how you breathe then very much interplays with that. And then suddenly you actually got a whole lot, and there's lots of different parts that you can go down, but there's so many different options of how you can help somebody without medication. and changing how you breathe in particular has been really powerful. And it doesn't matter how old somebody is. So I've had a thank you card recently, and that person was over, I can't remember exactly, they were about 70, and it was she mentioned she snored, and I said that really will be affecting your sleep if you snore, because essentially you're not allowing your body to feel relaxed and safe overnight, so your body will still be a bit more in that fight flight zone. And I just gave her a couple of resources to have a look at, and then she went away and really resonated that she needs to be breathing through her nose and slower, and she read the things that I said and put that into practice. And then I got a lovely thank you card to say suddenly now she was sleeping much better. And then obviously if you sleep better, you've got more energy, and she was going for more walks with nasal breathing, and that's the thing that people sometimes, I think, as we get older, we think our bodies are like so fixed and unchangeable, and it's just a downward spiral till we eventually die. And that isn't true. That isn't true. We can manipulate our body, we can create new nerve connections, which we call neuroplasticity, and we can alter how we breathe. If we breathe really fast and open mouth and irregularly and compared to if we breathe in and out through the nose, it's slow, it's gentle, it's regular, then we essentially can switch between telling our body we're unsafe in that fight flight mode, put the body into defend or defense mode, or we can breathe in that slow, gentle manner, nasal breathing, which is telling our body that we're safe, telling that body the body can feel safe, it can actually repair and recover. And I definitely think I have a passion for anything breathing, to be honest now, but definitely sleep disordered breathing, because I just think, I think the way you breathe when you're asleep obviously tells you how you breathe unconsciously, because that is your unconscious breathing pattern. So that tells you that, but then you can make such a difference if you train yourself to breathe unconsciously more efficiently, you'll sleep better, and there's so many knock-on effects from that. So I think the biggest thing for me is actually having my eyes open to how many of our patients have sleep disorder breathing that are it's unrecognized by the patient, it's unrecognized by us as a doctor, and perhaps it is recognized by some patients, but they don't want to come to the doctor about it because they don't want to be diagnosed with sleep apnea, they don't want a CPAP, and they're worried about the impact on their occupation and driving. And it's not all about a CPAP machine, there's so much you can do. It's not just about that. So yeah, there's lots of aspects, but I think sleep and mental health, how you breathe, to improve or worsen mental health, are the two big ones, I'd say.
Yeah, I agree. So I have two things I want to follow up on. That is, first I'm going to tell a story, and if I forget, my cue is talking about health professionals and what you would change there if I forget what my question is. So the story, so I was in February, I was on a plane, first time since COVID. I had noise canceling headphones on, and I felt myself, I was just feeling super anxious. I was like not super anxious, but I could feel myself starting to vibrate. I wasn't as present. I was distracted by something. There was a weird energy around me, and I was just, there's no reason, no cognitive reason I can figure out why that was going on. So to help me get present, I take the headphones off, I connect with my environment. That's when I noticed I was in the middle row. The person in the aisle row on the other side was sleeping and had very severe sleep apnea. So I didn't hear what was going on because I had noise canceling headphones on. So as soon as I took this off, I could hear this choking thing, and I look and you can see like still sound asleep, choking, face going red, body tensing, and then all of a sudden this gasp for breath, and they have like I don't know, I'd say maybe 10 big breaths, and then the breaths would slow down, and then he was in about a 5-minute cycle of like gasping to having a few minutes of quiet, to slowly it would build over a few minutes to where he was having, I would say, up to 30 seconds, if not longer, of not breathing times. And he wasn't opening his eyes and waking up, but the energy that gave off is what I was picking up on. It affected everybody around him. I started noticing everybody else on the plane staring at him. And yeah, just the person I was flying with, I had a conversation. I'm like, do you know what sleep apnea is? And she took off her headphones and she's like, no. I'm like, and then her eyes jumped out of her head. She's like, that is terrifying. And I'm like, it is. I'm like, can you just imagine what that would feel like in your body and how that affects everything about you. About, if you just think about how it affects your sleep, so then that affects your, how you production in a day, your function in a day, your social relationships. So that impacts your work, that impacts your family, it impacts everything about you. So, and often in the medical field, it is just seen as a sleep apnea is more of a solution, but there's nothing getting to the cause. So breathing may not fix your sleep apnea, but it will help you improve it. Or doing breathing practices will help improve it, may not take it away, but if there's some improvement, then that has domino effects on how it affects you in your life and affects those people around you. If this person had done some breathing practices for a month even before that plane ride, the domino effect of how everybody around that person on the plane would have felt differently, instead of feeling that weight of that suffocation and that fight or flight and that body fighting to survive every 5, 10, 15 minutes, whatever that cycle was, is pretty impactful. And how, so the heart math training I learned about your coherence and connection with the world and people around you, and you pick up on their energy. And that's what I was picking up on that plane, and why I took the headphones off, because I felt the energy was different and I was feeling something heavy, feeling anxious about it, and I couldn't figure out why. So that his energy was affecting the people around him, not just the sound, not just the visual, but just that startled and alarmed state. So it's yeah, that moment was pretty impactful for me, and just seeing the trickle effect of everybody around, and like the people sitting in the middle seat and right next to this person was literally like all the nonverbals were there of like, what's happening? I don't understand. And yeah, I can only imagine how uncomfortable it was for that person with no noise canceling headphones and not understanding the physiology. Yeah. So on that, how breath work, how that can really change a person's life. And if more health professionals understood how it affects our physiology, it would give us, doesn't matter your profession, a physician, a nurse, OT, RT, psychologist, social worker, like domino effect, dentistry. If more people understand the impact of breath work and what type of breath work at the right time for the right need for the right person, like there's a whole formula there, it's not a one size fits all package, it can really have an impact. Do you agree with that?
Oh, absolutely, completely. I mean, just, you know, just going back to that person on the plane. I mean, can you imagine how you obviously knew how everybody felt, but yeah, as you touched on, you know, to be that person, to be going through that, and you know, oh gosh, there's so many people who this affects, and obviously the brain as well. The brain is it's one of the most metabolically active organs in our body, so it needs a lot of oxygen. And essentially, you know, when people have bad sleep, they desaturate their brain, and that has a very negative effect. Absolutely. And I think I've lost my train of thought now. You remind me of the question. I've lost it. Yeah.
You're wrapped in the emotion of it all, of like,
I am wrapped. I feel genuinely, because the trouble is I struggle a little bit because I want to get the message out about sleep disordered breathing, but I actually find it, because I know the negative consequences on like disease, so we'd call it mortality and morbidity, so in lay terms I suppose that's death rate and negative health outcomes, and I know how negative it is, and I don't want to scare people, but I don't want to scare people, but it is something that it's so important. It needs to be, and as you said, it's like someone's actually struggling to survive when they're asleep, you know, so they're in that fight flight zone. They may be dropping their oxygen levels overnight, and there's no way that body's going to repair and recover, you know, absolutely not. And we know, I certainly have read a study where it appears that desaturation, that lowering of the oxygen level when people are asleep with sleep apnea, it can actually damage the fatty covering around the area of the brain, and the ones that seem more susceptible to that are the sort of learning and memory centers. You know, and how many health professionals, and I'm guilty of this before I went on my deep dive in breathing completely. If someone came in and said, I've got gaps in my breathing, okay, you know, I wouldn't miss that one. I'd be like, oh, that might be sleep apnea, I'll refer you for a sleep test. But if someone came in to me and said, I've got memory problems, I'm tired, it wouldn't be my first question to say, well, you know, I might ask, how are you sleeping? But I wouldn't be asking, how do you breathe when you sleep? And that's the next bit. And I think, I definitely think we need to have our eyes opened. I don't know if people know, but as women transition through the perimenopause and menopause, there's a steep rise in the rate of sleep disordered breathing. And that's a big, it's a spectrum. So it could just be like noisy breathing at one end, where it's just the air is more difficult to come in. It could be heavy snoring, maybe in the middle. And then you've got the sleep apnea, as you described, with the big gaps in that, and that's a spectrum. And there's always more men that have sleep disordered breathing than women, always, at any age, but there's a steep rise as women go through the menopause, and it's thought to be due to hormones. And that study, or one of the studies on this, it said that the women were less likely to come to the doctor complaining of snoring or gaps in breathing. They were more likely to come with fatigue, nightmares, lack of energy, mood changes. So we need to be thinking, if women are complaining of that, or any, you know, men or women, if they're complaining of that, you know, how are you breathing when you're asleep? And I found it incredibly upsetting, because the amount of times that I've asked people, how do you sleep? How do you breathe when you sleep? And then so any snoring, any gaps in the breathing, and they laugh. They laugh and say, oh yeah, I've started snoring. My husband's now moved out of the room, or my partner, or so my partner's nudging me when I don't breathe, and they laugh. And there's not a lot of people don't recognize that as a huge issue. And I think that it's really quite sad. But I definitely think, people used to come to me more with snoring at the beginning of my career, but they don't now. And I don't know whether people have just got fed up, because all the doctor would offer would be to say, stop drinking. And I've done this completely. Stop drinking alcohol, lose weight. And if they've got nasal congestion, I'll give them a nasal steroid spray for their nose. It generally didn't work. And then they stopped coming. But there's so much more, because you can re-educate your body to open up your airway, improving you know, breathing at the volume that we actually need, not over breathing, and it can have a dramatic effect on, I mean, I would never say to anybody that breathing's a cure-all. I would never ever say that, because people are complicated, and breathing is one part of that sometimes, and sometimes it's a jigsaw puzzle. But if you built a house on a sandbank and you expected that house to be still there in 200 years, well, we'd probably say it would be a bit daft, wouldn't we? Because it's built on sand, you would expect over time that it to develop cracks and it might start to sort of break and fall down. Well, breathe, you know, if you're setting up your body on a foundation of inefficient breathing, your body will always try and survive and make adaptations in that, but there will be cracks that will start to form. And I think if we can get as many health professionals as we can to recognise that, because once you've seen inefficient breathing and you start to recognise it, you'll see it when in the patients or the clients that you see as you come in.
Oh, totally. See it everywhere. The people with the most diagnosis, the most medications, they're harder to manage, have more dysfunctional breathing patterns. So
Exactly.
I don't say that as a way to shame. It's just what the pattern that tends to show up.
Yeah.
And traditional medical model of dealing with patients who have chronic complex medical needs, we've, as a medical healthcare system, have had limited resources. It's a vast resources, but they're limited when you think of the whole spectrum of well-being. There's a lot of miracles that traditional healthcare and pharmacology can do for people, but that's one piece of the puzzle. There's a lot of other pieces that isn't always looked at. So when you say somebody who has a lot of chronic health conditions and very complex cases, and they tend to be higher population of dysfunctional breathing, that's not being said in a way to shame people. It's just to outline the patterns that we see. And it's no fault to them. It's no fault to the healthcare system. It just is what it is. So as we learn about it ourselves, we see how it impacts our clients. And we also have the self-awareness of how it impacted my life, your life, and people who've also more of those anecdotal stories of people who've tried it, how it's impacted their life. More and more research is coming out on breathing, on our autonomic nervous system, and under the umbrella of our psychoneuroimmunology, and how our breathing and our presence and our mental health affects our well-being, affects our health, affects our immune system. There's an interconnection there. And that's really what we're talking about, is this interconnection of presence, mental health, self-awareness with your breath, with your health, and how that works all under the umbrella of well-being. So I had a family come in at the clinic I was working at recently this month, and the parent asked me if I had like a toy or a sticker or something to distract their child when the child started to cry. And I said, oh yeah, so I was responsive, help distract and settle the kid. And then I was just curious about like, okay, this parent had a little anxiousness about that question that I picked up on. So I asked about that. Like, so what, can you kind of open-ended, like what was going on there? And the parent said that their child, when they cry hard, throws up. And that they've gone to this doctor, this specialist, this clinic, this whatever, nobody's figured anything out. And I'm like, so I sort of thought about and went back into that moment, and I really thought about it from a different lens. And then I just really noticed, and like, this might not be the case of what's going on, but here's something to investigate. The autonomic nervous system, I think what's going on for this kid is a vasovagal response of too much parasympathetic. And this is what can happen. And this is how it looks like. And I'm not going to take that time right now to go through that, but that the parent is like, just their brain's churning, connecting with what's happening in the past with how I'm explaining the nervous system, how that affects your physiology, how that can affect to causing somebody to have little throw ups when they're emotional and pressure changes. And yeah, anyways, I don't need to get into the physiology. And then you just see this parent just sit there and kind of quiet, and you can see their brain working, and they're like, I see what you're talking about. There's something there. I'm like, you may go to your specialist appointments, you may not hear them talk about this, they may discount what I'm saying, but you as a human, you as a parent, I wrote down on a list, on a piece of paper, some things to research. I'm like, if this resonates with you and it's helpful, great. And just talked about co-regulation and how you do some breathing co-regulation as a parent to help co-regulate the child. And so it's unfortunate the clinic that I work in, I don't get much follow-up, but I'd love to have follow-ups with situations like that of like, aha, let's look at this problem that nobody's been able to solve from a different perspective. Because it's very, also what we're talking about, it taps into a very subjective point of view, and it's not as tangible as an objective measurable thing. So when you get into health professions, if it's very subjective, it's a lot harder to measure and it's a lot harder to gauge. And as health professionals, we tend to be very objective. So it's really hard to make that shift in health professionals of let's tap into this subjective thing. Yeah, any thoughts on that?
Well, the thing I was just going to mention is there's a paper, I have just brought it up actually, that that was actually published in 1975, so almost 50 years ago, by Dr. Lum, and he was a respiratory consultant at a hospital in Cambridge in the UK. And he started to notice there was lots of patients referred to him, either to respiratory or to the cardiology, the heart department. And they went through a load of tests, and a lot of them were told, essentially, there's nothing medically wrong with you, just basically go back to your GP. But he started to notice a common sort of pattern recognition of what symptoms those were. And I'll briefly just go through that. And then his conclusions at the end, I think, are so pertinent. And I feel a bit sad, to be fair, that we're talking about this nearly 50 years later, and I think there's a shift now, that there's a recognition, but why on earth has this not been sort of raised in the last 50 years? I think he did get some criticism because he just focused on hyperventilation as a way of breathing, not so he focused on what there's different ways of breathing inefficiently, and sort of hyperventilation is just one way of that. So I think he got a bit of criticism about that and a bit of criticism about the carbon dioxide, but I really don't think he was that far off. So his conclusions were three conclusions. We each probably see at least one of these patients a week. In primary care, I would say he's a hospital consultant. I would say I see patients like this on a daily basis. The number two conclusion, the type of breathing is utterly characteristic, virtually diagnostic, and seldom recorded in the notes. And number three, the size of the case folder is a frequent pointer to the diagnosis. So exactly what you say, patients that have got lots of medical problems, we're sort of stuck and not really helping them, definitely points to I use the term inefficient breathing as a sort of lay term, but dysfunctional breathing would be more a medical term for that. And so a couple of things, the symptoms that he recognised were sort of common things that he noticed were palpitations, fast heart rate, chest pain, Raynaud, so that's where you get cold hands and feet, dizziness, pins and needles, particularly in hands and feet, shortness of breath, asthma, chest pain, a feeling of a lump in the throat, feeling like a lump when you're swallowing in your food pipe, pain at the top of your stomach, excessive swallowing of air, muscle pains, tremor, tension, anxiety, fatigue, weakness, exhaustion, sleep disturbance, and nightmares. And I would actually say, I think a lot of those symptoms have some crossover with COVID, and have a lot of crossover with perimenopause and menopause. I know people can pick apart that paper, but I actually think he did a really good job 50 years ago, and I think he stood out in his medical profession to say, you know, there is something wrong with these patients. I'm telling them there's nothing medically wrong, but I actually think they're over breathing. So actually I don't think he was far wrong. I think there's more bits to it, but yeah, so I think it's and definitely any frequent people that attend frequently to our surgery, I think that there is some element they're not breathing as efficiently as they can do, and that could be potentially improved. But yes, but one of the difficulties we have, don't we, with the medical profession is we don't actually have a gold standard of diagnosing or assessing. We can diagnose dysfunctional breathing, but actually to have an assessment for it that we all agree on, that you could use in a research paper, we don't really have that. So how on earth can we study it if we cannot objectively assess it to diagnose it, or to diagnose it we've improved that, well, we've got a problem. And I don't know what it's like for you, but if I try and code dysfunctional breathing on my computer, it doesn't exist, and the nearest I can get is psychogenic hyperventilation. I am not going to record that in somebody's notes, and particularly not if they're someone might be over breathing, but it might be nothing to do with their mental health. So I'm not, and then the trouble is the NHS go off those codes. So if suddenly I had a code for dysfunctional breathing and lots of health professionals in the UK were suddenly coding that on the computer, the NHS would be like, oh gosh, we've got a massive increase in dysfunctional breathing. We must put some money into that and research it. How do we make that better? But I can't even code it, never mind make an assessment. So I'm like, oh, but this absolutely affects people. And I definitely, I probably feel I make more difference to people by improving breathing patterns, helping them regulate their autonomic nervous system, and also probably helping them realize that trying to take their body back to how their body's been biologically programmed to be. But sorry, that's a very long-winded answer.
Yeah, it's perfect. I really like the transition there to ancestral health. So before traditional healthcare that we have right now, before that was invented, however many hundreds of years ago, or more recently in the last 100 or 50 years, ancestral health is just how people would around the world, doesn't matter what culture you're from, how you dealt with health. That there is so much wisdom in there that has been lost. And just because it is old, it doesn't mean that it is irrelevant. It is very relevant, but a lot of it ties into that whole subjective thing we're talking about, that you have to have the interoception, the self-awareness of what's going on, and tying into your intuition and reading somebody else at the same time. So using your intuition to read somebody else's energy and what's going on there. And again, that whole subjective thing, how do you take this subjective thing, turn it into a measurable, objective protocol, and take it from there to take it into more common practice? That is very difficult. And I really like how you tied it into, if we can't get coding for this because we don't have the objective, but how do we get the objective? How do we get the science? How do we get the movement without the coding to show the need? And just that vicious cycle of like, how do you get out of that? And how educational systems, how science, statistics is very, very based on this objective measurable thing, but not everything. We don't even have the language. Our language is even lacking in what we're talking about. So we keep on using this word breathing in our breath, but in a way it's cliche, but those two words don't actually encompass enough of what we're talking about. It's a lot bigger than just the semantic words of breathing. So we don't even have the language to talk about how this affects us and what's going on. So then how do you also missing the language, then how do you also take it to that next step of really domino effect to the healthcare system, to communities and cultural cultures, globally.
No, I completely agree, definitely. And I think I definitely I think when you've experienced it yourself, so I didn't one day wake up and go, oh, I want to be a breathing practitioner and jump into it. It was way more protracted than that. And definitely the most powerful thing for me was developing a perimenopausal snore, and other symptoms. Went on HRT, got rid of 3 of my symptoms, but my 4th symptom, snoring, stayed. I know I had personal experience of waking up feeling unrefreshed, my head, like, you know, brain fog, trying to do a profession, not quite being able to think right, the effect on, as you've said, the relationship, because my sleeping partner, my husband, and then disturbing him. I'm cranky because obviously I've not slept well. He's not going to be overly happy because he's not slept well, and that whole thing. And then when I improved my breathing patterns and really worked on it, not only did I then lose my snoring, I actually sleep now the best I've ever slept. I run with much more ease, and my ability to, I just generally feel calmer. But when I'm presented by something that does trigger potentially a sort of stressful event, I can recognize that earlier, and then I can decide whether I want that fight flight response or whether I want to sort of change things around and calm myself down. And having gone through that, obviously is hugely powerful, because then you know the science, you know what impact it's had on your body. And then I went on my breathing practitioner training. But the most powerful thing I've found is actually, you talk, I've done lots of presentations to health professionals, and they get the science, like yeah. But then there's a sort of disconnect with, how do I bring that into my day job? But then I've had people that I've seen either on an individual basis, or they've been part of my group programs, and they might be coming for different reasons, whether it's stress management or they've got sleep disorder breathing, but they then correct something in themselves, and they feel that change in their body, and actually have that practical application of the science, and actually like, God, this is so important, you know, this really matters. And then they start noticing it in the patients, and then they're trying to signpost. So yeah, it is definitely, there's one thing talking about it, but I think as a health professional, if you can experience it either from, I've had a doctor who's on the course that she didn't have a particular issue, but actually just so happened one of her patients who had sleep disorder breathing and probably undiagnosed sleep apnea was on the course, and she saw how that patient improved, and actually her probable sleep apnea stopped, and that was incredibly powerful to her. Yeah.
It's so interesting how you tapped into something there, and I just want to circle back to it. I'm going to take medical training. So it doesn't matter what type of health professional you are, doctor, nurse, whatever. We tend to get into specialists. Like for doctors, you know, you're a surgeon, you're a cardiologist, you're whatever. You get into a specialty, and usually people get into that specialty because they have a curiosity about it. And so they have a curiosity about the heart, they understand the heart, they can visualize it, they understand the pathology, and it really comes easy to them. So they tend to go into whatever stream that is. Same with nursing, you have an interest in kids, so you go into more pediatrics, But the one thing about breathing and breathing practice, and as a health professional, is it starts differently. Most of us, we have that aha moment, that self-awareness piece, and that's what really gets us on that path. So it's a very different approach than most other specialties in the healthcare profession. So when you have that different approach to it, it really goes to a deeper level, because you have to have that self-awareness, that introspection, that aha moment, and connect with it to really go down that path. And that's also one of those gaps of, that's asking a lot of people, because you have to really, like channeling some Brene Brown, like you really have to deconstruct and reconstruct and build yourself up and think about your self-talk and your shame and all that stuff as you go on this process. And that's not something that everybody's willing to do. And that also impacts how people are going to, as us early adopters in the healthcare profession, we're early adopters to this. So you really have to come at it, and we do come at it from a different perspective than other people in other specialties. Yeah.
And I definitely, and I think the more, definitely my experience has been, obviously there's such a spectrum of how people breathe, you know, if you like, you know, if you look at dysfunctional breathing, that's like one term, but you can have someone who's really very inefficiently breathing, sort of, you know, extreme dysfunctional breathing, and then someone that maybe is not as bad. The person that is obviously more severely breathing dysfunctionally is going to take a lot more effort, and it's going to be a lot harder for them to shift to a more efficient breathing pattern, but they will have so much more to gain with it. And certainly what I've found with people is there's a bit where they have to put themselves a little bit out of their comfort zone, because their body is designed to breathe in this way. And they often, you know, I teach the science and things like that, and they get where they want to be, but they've got to grapple with their body, because they're trying to go, no, I don't want to breathe like that. And their body goes, no, I want to go back and breathe like this. And they go, no, I want to breathe like this. And they're trying to make that muscle memory and make those nerve connections. And there's a bit of sort of wrangling, and you know, they have to put themselves a little bit out of their comfort zone, because you know, none of us, well, no, I shouldn't say none of us like change, but sometimes change can be scary for people. But once their body gives a bit, I find this, and it takes longer the more inefficient it is, but once the body gives a bit and actually goes, oh God, you know what, actually I feel a bit better breathing like that, it gives that give, and then the body relaxes a bit more, and then that person's feeling a bit more benefit, and then they seem to fly with it. But it can be a bit difficult at the beginning, but I think the most I think one of the most empowering, well, two things that I think is really empowering about reteaching your body to breathe efficiently is, number one, you realize your body is not fixed, and your body can actually improve rather than just deteriorate as you get older. And number two, I think you teach yourself to be more comfortable with being uncomfortable. And
yes,
and that is so empowering, to know that I didn't feel comfortable switching, but I did, and I actually feel better for it. And actually I've had that power to do that. And that's the person has done it. You know, we can be their guide. They can have done it from a book, but ultimately the person's put the work in every day, and they're the one that's proved to themselves that they can change, and they can put themselves out of their comfort zone.
Yeah, I really like that statement. It's like, I've just gone, what did you just say? It just, as soon as I went to
about the two things. So
to have the comfort and the discomfort.
Yeah,
like that's a powerful statement, that our world, our society is about comfort, central heating, memory foam mattresses, having our car in a garage that's heated, to have heated or air conditioning vehicle to our heated air conditioning building. Everything's comfort. We actually don't know how to, or from a nervous system point of view, we don't know how to have comfort with discomfort. When you think of temperature, like I know you and I both do cold exposures. When you first start cold exposures, there's discomfort in that, and there's a way to do it in what you can use the word shock, or there's ways to ease into cold exposure that is less shocking, less alarming to your body, but also starts to transition where you find comfort, find ease, and start to crave that discomfort experience. And yeah, I really like that, how you tap into that, finding comfort and discomfort in a way that's not traumatizing to your system, not re-triggering trauma responses, but in a way that expands your adaptability. I really like that.
And our nervous system has not been designed to be in comfort, has it? It hasn't. You know, we have been designed, exactly as you said, to have periods of you know, fasting, periods of food availability, periods of cold, periods of heat. You know, we have been designed, and our body can come back, and actually when we put ourselves through discomfort, it can actually make the body sort of throw back and sort of improve ourselves. But I appreciate when someone's feeling rubbish, that's perhaps the last thing they're thinking about. I get that, but I have to say, I think that's where when breathing comes in, because I always start off by teaching people, a lot of people are in the fight flight sort of zone, teaching sort of how to downregulate, how to induce that parasympathetic relaxation response. But then I do bring in then exercises that rapidly shift between the fight flight and the parasympathetic response, because we want that flexibility. We don't always want to be in parasympathetic. We want, when our body is threatened, we want that sort of switch to quickly go into sympathetic. So I think, yeah, and then I think it naturally comes then that if you put yourself out of your comfort zone with the breathing, you're like, I could cope with a bit of cold exposure, I could cope with a bit of other things. So
yeah, and you have to have that self-awareness to know when you can cope and when to handle it, because not every situation, every moment is a good moment for fill in the stressor. You need to be able to put the whole picture together in the moment, and having self-awareness for that. So I think we need to have another conversation about cold exposure and autonomic nervous system and trauma responses. I think there we have the next topic.
I think that would be a fantastic one, definitely. Autonomic nervous system, I'm absolutely, I just think it's an amazing system, and I think not enough people know about that. So yes, if we could have another conversation, that would be fantastic.
Yeah, because again, seeing it from a whole holistic point of view versus just the function of it. And it's not an on-off switch. There's a dimmer switch, and kind of like on a teeter-totter on a scale, and there needs to be balance. There's times where you need one higher, there's times where you need the other one higher. And anyways, that is a whole nother topic, so we don't need to get into that now.
Well, it's been a fantastic conversation. I've really enjoyed it.
Me too. So if you like one statement or a few words, what are you grateful for about and learning about this breathing practice?
I feel now that now I've gone this deep dive, I actually feel I'm helping people again. And I'm really grateful for that, because I lost for a while, a number of years, that I really felt, my reason was to be a doctor, was to help people, and I didn't really feel I was sort of delivering that, and became a bit disillusioned with that. And now I actually feel that passion's reignited, because I feel that I can actually help people who are willing to, who are ready to sort of engage. I feel I can help people, and I think it's something that is foundational upwards, and it can have, as we described, these knock-on effects. So I'm really grateful that I chose mindfulness at my appraisal, and went on this very, very convoluted route to becoming eventually a breathing practitioner and helping people. But I'm really, really grateful for that. And if people don't sort of pick anything up from this, I think it's how we breathe matters, particularly when we're asleep, and the nose is so important to breathe. Yeah.
So it really, starting with the mindfulness, led you down into a rabbit hole that led to the breathing, and realizing now breathing affected everything, and it gave you more tools in your toolbox.
Completely and utterly. So now I have how I manage things. I still believe in traditional medicine, don't get me wrong, and I will still obviously do traditional medical things, but I will always sort of I might not be able to I can give a brief explanation. There's a lot of signposting that goes on, so in those patients that are interested, I'll encourage them to go away and read some resources that I'll give them. But I'll generally, if I can, give someone a non-traditional medical way of dealing with the problem. Awesome. And it's amazing how many more people are open to that, and who actually don't want tablets and things.
Yeah. And as a nursing perspective, once I came onto this breathwork journey, I recognize my ability to help in the moment with clients. My resources also hugely improved. So there's a lot of in the moment things that we have to deal with clients, whether it be pain, anxiety, worry, regulation, you name it, everything, because every moment of people's lives, nurses tend to be in everybody's lives. it has given me more resources to deal with, whether it be pain, passing out, anxiety. I have more resources to deal with that. So that's, yeah. So very grateful for how understanding and learning about this has helped me in my life and my personal journey, and how it has dominoed effect in my ability to be a parent, a friend, somebody in the community, as well as a nurse in my profession. And it's really impacted me on my health literacy, health education sort of crusade I'm on, of let's think about things differently. Let's look at things differently. Let's put more power into a person's hands, a person's control, instead of how through the generations, how power has been shifted to the healthcare system and less autonomy and less understanding. And there has been a shift in our generation to having more autonomy. But now let's get the health literacy in there to really understand what your autonomy is, what you have control of, and what your options are. So yes, I would, and this is just one way. Hugh and I talking about this today, about breath and just about self-awareness and interoception. It's just one way to get there. So just one more thing I wanted to tap into is you talked a few times about your assessment. So I'm just going to explain what that is for people who may not understand.
Yeah.
As health professionals, we are regulated under our governing bodies, and we have to meet certain standards that we are up to current practice standards. So we have to do a little assessment and write up and little dive into a rabbit hole of what learning something every single year. So you started with yours as you went into a little deep dive into mindfulness, and from there you kind of got into this rabbit hole of self-awareness and breathing and how that impacted your practice. And I had a similar journey, but mine was more, I was having my own health journey, and through my health journey, one practitioner I was seeing made a comment to me of like, okay, slow your breath down, Ber. And it agitated me, and like, I'm a nurse, don't tell me I understand about the breath. I'm like, I'm breathing fine. As you can tell from my tone, very reactive response. So I went home, and in my irritation, within a month or some sort of timeline, I'm like, fine, because it stuck with me, my reactivity and being told that stuck with me. And I went down and I'm like, I'm going to research and how that take a deep breath is garbage. It means nothing. I'm breathing fine. And so I have to say two things. One, I was very humbled. Breathing and a place for breathing. There is a place for that. But deep breathing, the way it is described in society, is not necessarily the answer, because there's a difference between what we talked about earlier and having a full breath versus a deep breath. So I will give an example. When somebody says, take a deep breath, and I see this every single day at work, it's like, so it's very loud, very oral, very fast, very activating, where you're like, right there in the moment, that person has anxiety, has pain, you want to do the opposite. You actually want to slow it through the nose, change the energy. Yeah, so in some ways, I was very right that the deep breath that they're referring to wasn't the answer, but I was very humbled that I was wrong, that there's a lot more to it than I thought. So thank you for listening to my story.
But and I fitted coils for a long number of years, and definitely the thing that people say, because I normally have an assistant, is take some deep breaths, and exactly what you say. So we've got someone who is having a very intimate procedure, is obviously not going to be in a relaxed mode, maybe feeling some discomfort, and then we're essentially hyperventilating with a, and then you so yes, like, oh right, okay, should we just close the mouth, and let's just slow down, in and out of the nose, just slow it down. But yes, it is, and it's trying to change that perception, and I totally, I did not realize the importance of that till I go down. So I've gone down this rabbit hole, so I'm not being critical with anyone. If you don't, I for a long number of years knew very little about breathing. So if you don't know, you don't know what you don't know, do you? That's the thing. But hopefully over time people have more awareness, and it'll improve.
Yes. Well, thanks for your discussion today. Let's definitely do this again. Well, I'm sure we can come up with tons of inspiring topics for us, and hopefully people will engage and understand and connect with what we're saying. Thank you, Dr. Louise Oliver. Louise, please come again. Instagram, how can people find you?
On Instagram, I'm Dr. Louise Oliver TLC.
Okay. And Meliora.wellbeing, and my personal one is bers.perspective. Okay, thank you, everybody.
Thank you.